Fluconazole cures fungal infections without harming your human cells. How? It exploits a structural weakness. To survive and spread, fungi must constantly expand their tough outer membranes. Take an actively dividing Candida yeast cell causing an infection. To hold that expanding boundary together, the yeast relies on a vital, cholesterol-like building block. That structural molecule is called ergosterol. But unlike human cells, the yeast cannot just absorb these pieces from its environment. It has to manufacture every single molecule from scratch, using its own internal assembly line. At the very end of this line sits a critical molecular machine that finishes the job. This final worker is a specific enzyme known as 14-alpha demethylase. This is exactly where fluconazole steps in. The drug acts like a perfectly shaped mechanical wedge, binding directly into this exact enzyme. It jams the gears, completely shutting down the manufacturing process. Depleted of new structural pieces, the fungal membrane becomes weak and defective. It can no longer expand, permanently halting the yeast's ability to multiply. So what ultimately happens to that actively dividing Candida yeast cell from the beginning of our story? Stripped of its structural building blocks, it stops multiplying entirely, and the infection slowly fades away.